We'll start our media availability with the report from the Chief Medical Officer.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us again today. As per usual, I'll begin with an update on the number of cases in our province. Since the media briefing yesterday, we have had 2 new positive cases. These cases are within the Eastern Health Region and Central Health Region. The public health contact tracing is ongoing, and everyone considered close contacts will be advised to quarantine. The total number of cases in our province now is 228. By region, we have 217 cases in Eastern Health, 4 in Central Health, 1 in Western Health, and 6 in Labrador-Grenville Health. 54% of cases are female and 46% are male. By age, we have 20 people under the age of 20, 34 between 20 and 39, 33 between 40 and 49, 50 between 50 and 59, 48 between 60 and 69, and 43 who are 70 and above. 7 people are in hospital due to the virus. Of these patients, 2 are in intensive care. 49 people have now recovered, and in total, we have tested 3,958 people. Today is World Health Day, and this year's theme, Supporting Nurses and Midwives, recognizes the vital role that nurses and all healthcare workers play in our healthcare system. World Health Day promotes the importance of living a healthy lifestyle as one of the most effective ways to reduce the risk of disease, and the timing and theme this year could not be more appropriate. It is especially important today to highlight the incredible dedication of our province's healthcare workers. To the hundreds of you who leave the safety of your homes and families each and every day to support and care for us during COVID-19, we offer our sincerest appreciation and thanks. Your unwavering perseverance and commitment during what might surely be the biggest challenge of your working career is not only commendable, it is truly inspiring. We cannot do this without you, but we can do our part to help protect you. By staying at home, we can help reduce the risk to healthcare workers we are relying on to keep us safe. This is at the least we can do to support the ones we are depending on the most. As COVID-19 rapidly evolves, so does the evidence. We are continually working with our federal, provincial, and territorial partners to provide you with the best available public health guidance and advice. Based on new learnings from other countries and analysis of transmission patterns, recent studies have shown that the virus can be transmitted from a person infected before they develop symptoms. This is referred to as pre-symptomatic transmission. There is also evidence that some people infected with COVID-19 who never develop symptoms are also able to transmit the virus. This is called asymptomatic transmission. While it is unknown at this time the extent to which pre-symptomatic and asymptomatic transmission is taking place, we do know that it is occurring among people in close contact or in close physical settings. The vast majority of transmission of COVID-19 occurs when individuals have symptoms such as coughing, fever, aches and pains, and headache. To prevent transmission of COVID-19, here is what we know is proven. Staying home unless it is essential to go out. Physical distancing. Washing your hands. Protecting the most vulnerable from infection and exposure to others. And covering your cough with tissues or your sleeve. These measures will work to reduce the spread of COVID-19, whether or not someone has symptoms, and it is critical that these measures continue. There has been new information regarding the use of non-medical masks and face coverings in the news recently. First of all, let me say, the use of medical masks must be reserved for the use of healthcare workers. However, the use of non-medical masks and face coverings, such as a homemade cloth mask, can be an additional measure to protect others around you by preventing your respiratory droplets from contaminating others or landing on surfaces, even if you have no symptoms. This may be particularly beneficial for short periods, such as when grocery shopping or while using public transit. In keeping with the latest evidence, we know that wearing a non-medical mask, such as the homemade cloth mask, in the community has not been proven to protect the person wearing it. So using a homemade cloth mask protects those around you It won't protect you from contracting the virus. Please remember that wearing a non-medical mask when in public or in other settings is not a replacement for the proven prevention measures such as hand washing and physical distancing. If you do choose to wear a non-medical mask, ensure it is well fitted and avoid moving it around or adjusting it often. Don't rub or touch your eyes, as this is another route of infection. Be mindful that masks can become contaminated on the outside or when touched by hands, and do not share masks with others. For more information about the proper use and handling of non-medical masks, please visit canada.ca/coronavirus. As a recap for those who may have just joined us, we have 2 new cases since yesterday's media availability. The total number of cases in the province is 228. That's 217 cases in Eastern Health, 4 in Central Health, 1 in Western Health, and 6 in Labrador-Grenville Health. Thank you again to those who continue to follow the public health protection measures in place, and for the sacrifices you are making to protect others. We will get through this together, but we must stay the course. Our collective actions will have a significant impact on how COVID-19 progresses in this province. Thank you.
Well, thank you, Dr. Fizgerald, and good afternoon, everyone. And as the Chief Medical Officer has already said, today marks World Health Day, and this year's theme is about supporting nurses and midwives. Although it is not business as usual in our province or in our country or around the world as we deal with this pandemic, I think it is important to recognize World Health Day that we've been working extremely hard to ensure everyone maintains their health and that everyone lives by the guidelines that we put in place. These guidelines are put in place to protect themselves and their loved ones. It's a time of uncertainty and a time of stress. It is important to recognize and to support our nurses and our midwives, now more than ever. Our nurses are some of the unsung heroes of the COVID-19 response, and I commend their courage and their commitment to our province. So thank you for all that you do, not just today, but every day. There's a saying that I've heard recently, which I think is very fitting for where we are in this very moment. Your health is what you make it. Everything you do today either adds to it or takes away from it. That's why we are introducing additional measures, giving grocery stores, as an example, the option to open on Good Friday. Well, the reason around this is this will be one of the busiest weekends ahead of us, a weekend that is typically filled with food and Easter gifts. So rather closing stores 2 of the 3 days on the weekend, we're giving grocery stores the option of closing just 1 day. The option to open is simple. It's to protect you, the customers, and the employees. This is about controlling the volume and promoting physical distancing. It's an option for businesses to consider. They're not required to open. It's about providing flexibility. When we made this option, we also made sure that employees would not be mandated to work on Good Friday. Their schedule can be agreed upon with the employer. If someone does not work, or if someone does work, they're entitled to double pay as per the Labor Standards Act. So we're supporting our essential workers like grocery store cashiers, as an example, with child care services if they require. Of course, the preferred method is to find private child care. If that's available, they'll provide it $200 a week to help cover their expenses. If they can't find child care, we'll work with them to find a child care center for them. Once again, thank you for all the individuals who work in our grocery stores, from the cashiers to those stocking the shelves and keeping the stores clean. We appreciate all the work that you do. Now, I do know that most stores will stay closed to the public on Good Friday and will use the time to prepare online orders, as an example, for delivery on Saturday. But once again, let's keep in mind, it's once a week and only for things that you really need. But I also know not everyone has the resources to shop once a week. A few days ago, I was pleased to announce $500,000 to Food First NL to support our work in collaboration with community partners. We've been working to provide food to Newfoundlanders and Labradorians who, unfortunately, are experiencing food insecurity during this pandemic. So I'm also delighted to say that since then, we've added another $60,000. So that's $560,000, and that's in addition to the $220,000 that we had already provided. Through this funding, Food First NL established a community fund, and this means we're able to provide immediate resources to eligible community food programs to continue to safely offer services across our province. So far, they've received 150 applications, and you'll be notified in the coming days. This funding will certainly help our community partners continue to do the great work that they do on a daily basis. In addition of this fund, we're in discussion with over 40 other community groups. So regular calls and regular contacts are ongoing as we work together to solve food insecurity in our province. And we also recognize there are a number of community partners and individuals making every effort to ensure our residents have access to essentials, including food. People like the school lunch program and the St. John's Farmers Market, they've partnered with Food First NL and Choices for Youth. They're moving food that the association has on hand to the farmers market. This will be stored there, and the food will go to the gathering place, Stella Circle, and Choices for Youth to provide meals to their guests. We're also working closely with seniors, Connections for Seniors, and Empower Seniors NL as an example in our province, to also consider and put places and make food available to seniors and some of the persons with disabilities in our province. As we're talking about food security and community supports, I also want to acknowledge some of the work that our farmers and food processors are doing during this difficult time. Despite their own challenges, they are supporting communities and ensuring staples are available. As an example would be Scottsbourne. They have recently donated some 3,000 liters of milk to food banks in the last week. That is what community is all about. That is what it means by working together to support one another. Of course, the federal government is an important partner in all of this. Just recently also announced some $100 million for food banks and local food organizations. So we'll continue to work with them to ensure that this funding meets the needs of our province and helps people and communities who are most vulnerable during this economic uncertainty. So it is about working together that we will see change in all areas of the work that we are doing to stop the spread of COVID-19. The time is now, so let's continue to support one another. But before I close up my remarks today, I want to let you know that tomorrow's briefing will be a little different. Our regular 2 p.m. briefing will be pushed to 6 p.m. as we will have new information to share with you. Now, you've heard us talk about the surge. So tomorrow we'll have further information on what the future of COVID-19 and what the impact looks like for Newfoundlanders and Labradorians. Now is not a time to be complacent. As we head into the Easter weekend, take every precaution as you go out for essentials. We must continue to abide and follow all the guidelines that the Chief Medical Officer has put in place during this public health state of emergency. Your actions today determines the future of this province and our residents tomorrow. Thank you. I will now turn it over to Minister Haggie for his comments.
Thank you, Premier. As Dr. Fizgerald and the Premier have both referenced, today is World Health Day, and it recognises a couple of very valued groups of healthcare workers. The Prime Minister also referenced the fact that today is National Caregivers Day, and I think it's quite appropriate in many respects that it's all come together on one day, and particularly at this time of the year, and particularly at this time of challenge for the province and for the world, really. It is difficult where I sit sometimes to be able to tell everyone of the shopping list almost of trades and professions that go to make up the healthcare system. And it is a question of the sum being greater, the whole being greater than the sum of its parts. We have carpenters, we have janitorial staff, we also have home support workers, we have people who drive patients to appointments, and there is a wealth of infrastructure below health in general. And it's very difficult to mention one group without others feeling left out. And I would just say on this day that it's time just to pause briefly and thank everyone. I think it is also a time of tradition. We're coming up to, for many faiths, one of the holiest weekends of the year. It is for them a matter of great devotion. The faith community has come together and provided a whole variety of options now where you can worship together, but do so physically distant. And I would urge all of you to look at this as maybe a new tradition to mark Easter 2020. For others, it's more of a family occasion, and it always seems to relate to food. It's fish and chips, or it's turkey at Nanny and Pop's. But really and honestly, this year we need to do things differently. We really do. Because the problem with all of these events and our entire approach is that they are predicated, they're built around gatherings of people. And we all have, over the last 3 weeks, gone to some great lengths to say these gatherings are now dangerous. There are other ways of doing them. And yesterday, I picked on the teens somewhat, and it's really easy to do that. And we all have, as parents, we've all had our moments there. But to be fair, the youth model the behavior they see from the grown-ups, from the adults around them. And just as disheartening as seeing, the teens in the parking lots, you have the drive-through, the coffee culture for the morning. We have encouraged people and indeed mandated people to go through drive-throughs. But then if you go and park in the parking lot and wind your window down, you're modeling behavior that you then criticize your teens and youth for. So we all have a role to play in this. And it's difficult because it's become part of our life, this interaction, this face-to-face piece. And really and honestly, this is what is dangerous. We are on the edge of a surge. And tomorrow, as the Premier has referenced, our predictive analytics group will talk about what the future may hold. These are possibilities, these are probabilities, and they are looking at the future through a fuzzy telescope, a fuzzy crystal ball. But they are things that we need to do because we need, as administrators, as civil servants, to try and be able to plan on your behalf for the worst case scenarios whilst hoping for the best. As I once said, hope is a girl's name, not a strategy. So we have to plan. And this is what we will show tomorrow has underpinned some of our approaches. We need to get this right this weekend. You won't notice the difference next week. You'll notice it in 10 to 14 days' time. And we've seen that lag, and we've seen the numbers shoot up. And this is going to happen. The only thing we can do over the next weekend is to control how high that peak is and when it arrives. We talked about informing the public, informing you of where we're up to and what we've been doing. Our crystal ball exercise tomorrow, our modeling, if you want to call it that, will help show where we're looking to. But we've also provided some information on locations of cases on the basis now that with the numbers that we have, we can do this in a way that will protect people's privacy. We put up a table and we had almost immediate feedback. What we'd done with that table is we'd used Canada Post's sorting mechanism to allocate numbers to areas. And I heard very clearly that that didn't really jibe well with the way communities viewed their own allocation, their own attachments. And Pooch Cove particularly was brought up on many occasions. What we will do today, having listened to that, is the table will be presented in a different way. And we're going to try using what are called primary healthcare service areas. These are areas where traditionally primary health care is clustered and centered around. And we've got 41 of those areas and zones across the province. And we'll try that and see if that is a more acceptable and user-friendly way of doing it. If you have any comments after that, by all means feed them back to us. We're still trying to then bring forth a map which will be more visual for you, translating those service areas into the way we collect data, which is based on postal codes. It's done for awareness. It's not done to pit one community against another. It's not done to pit rural against urban or assign blame or anything like that. The recognition, though, needs to be that no matter what the map shows, there are cases out there, it's in your community, and the only safe assumption is that the person next to you may well have COVID-19. You and they need to behave accordingly. What we need to do, and I've said it before, we'll say it again, and you'll hear it from me tomorrow, is that we have to build a protection of bubble around ourselves and our families. We stay in that bubble, we go out only when we need to, and we do not burst anyone else's bubble. This weekend is crucial. If we do not change our behavior, we, our children, our elderly relatives, our wives and family will pay the price in 10 to 14 days' time. I cannot be any plainer than that. And so, having said that, Premier, I'll turn the podium back to you. Thank you.
Thank you, Minister Haggie. And we'll now go to the media, which are outside of this room in their own bubble, in their own homes. So we now turn it over to the media for some questions.
Thank you, Premier. For the benefit of our speakers, we have 8 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. We will run through the telephone queue, and I will call on each reporter by name to ask questions. Please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Elizabeth Whitten of All Newfoundland Labrador. Please go ahead.
Hello?
Hi.
Hello? Oh, perfect. This question is for the Premier. Some government projects have been put on hold due to the pandemic, such as a government news and information webpage. What other kinds of projects have been deferred, and how do you decide what will be postponed and what work will go ahead?
Yeah, so there's a couple things that we've been doing. One of the things is that we've been putting out tenders, and this is really to let the construction companies within our province, they are able to use the time that they now have available to them to prepare for contracts that would be awarded when we're in a situation where they can be done safely. So this is really about letting people know that there will be work coming, but yet cannot be done as in this environment. So contracts like you've just mentioned is the same thing, is that anything we do right now, if it's something that we would need, require at this particular point in time, if they can be done safely, will we allow those to happen? But in particular cases where they cannot be done safely, cannot be adherence to the guidelines that have been put in place by the Chief Medical Officer, well, we can put those off.
Perfect. And on Friday, Minister, you mentioned there was a shipment due in from Hamilton of face masks. And yesterday you mentioned a similar shipment. I was wondering, are these the same shipments, and was there a reason for the delay?
One of the challenges is we have a lot of delivery dates that have actually just not been met because of the demand across the globe. We have had a delivery of masks. We are expecting some more. I will endeavor to get you detailed numbers if that would help you. But to be honest, until the masks arrive in our warehouse and we've counted them, I'm not counting on them. But we do have delivery dates for more supplies. The next batch, I think, of protective equipment is expected on the 10th. The only thing I can say at the moment is that's probably not the day it will arrive.
Thank you.
Our next questions are from Peter Cowan of CBC News.
We've seen the advice on masks go from they do no good to wear them if you want them to now you should wear them to protect others. What do you say to people who may fear that this undermines their confidence in some of the decisions and the directives that are being made when they see those decisions being changed fairly quickly over a period of time?
So this is a rapidly evolving situation, and as we learn more about it, the information is going to change and the advice is going to change. We've said that from the beginning. I don't think this is out of keeping with that. So as the information about asymptomatic transmission has come forward, I think this is in response to that. It is another way to help protect those around you. It is not something that we're mandating, but certainly for people who want to be responsible and want to try to protect those around them, it's an option.
We've seen the recommendation be essential travel only. With a long weekend coming up, a lot of people are going to be thinking about, maybe do I want to go to the cabin? What's your recommendation when it comes to travel to secondary homes, for example?
Well, for us right now, it's important that this be non-essential travel, or essential travel, no non-essential travel. So from my perspective is when I look at the people that you touch along the way. Of course, I know that people would want to go to the cabins, but there's always touch points along the way. You fuel up, you pick up extra groceries, you do extra things. So, for me personally, I would like to see people stay home, as they say, stay in their bubble, stay safe, and stay away from those touch points. Realizing that for those that are asymptomatic, there's sometimes a need to actually do some things. But the big thing in all of this is be responsible. My suggestion is for non-essential or essential travel only, and no non-essential travel. But it's very difficult for everyone, I guess, to stay away from the cabins, although I would encourage people to stay at home. And if for some reason they find a way there, that they not have any contact with others as well. Make sure you stay inside, as the minister says so many times, stay inside your bubble.
Our next questions are from Ben Murphy of VOCM News.
Thank you. Minister Haggie, you said that you did hear the feedback from the table released yesterday and that it will be tabled in a different way today using primary healthcare services areas. Can you just tell us a little bit about what that means and how exactly that's going to be different?
Yes, what we did yesterday with the first cycle of the table was we simply used the first 3 digits of your postal code, or what Canada Post call the forward sortation areas. This is one way of clustering data, and as we have a civic address through public health for the patients that have been tested, it was an easy way of aggregating it. What we've heard is that because of the way postal codes are assigned, it can be a challenge to go any further down, because if you use all 6 digits in an urban area, you could actually technically identify a single condo building, whereas in a rural area, 6 digits could actually mean an entire community of 400, 600 people. So based on that, and based on the comments, particularly around Pooch Cove, who didn't seem to like who they were bunched with, we used primary healthcare service areas, which is a functional allotment of geography that we use within the healthcare system. But now we've got to translate the data in public health, which is done on postcodes, into those areas. So we can do that fairly easy for a table, but for the map, we're just lagging a little bit behind.
And NAPE, just before, almost an hour just before this started, raising serious concerns about multiple issues related to PPE for frontline workers. They're citing a lack of communication. What do you say to them?
Well, we've had regular communications with a whole variety of workforce representatives, and NAPE is included there. One of the challenges around PPE is that we are no different than Ontario or BC or those kind of areas. We are good in comparison with some, but in terms of where we would comfortably like to be, we are not. Our priority is to make sure that frontline workers in healthcare, from the point of view of the healthcare procurement, are protected with the right personal protective equipment. It's a two-way street. We can get the supplies in. They're not as liberal and they're not as free and they're not as large deliveries as we would like. But there are very clear evidence-based guidelines as to what equipment to use under what circumstances. And it has been a discussion point to make sure we're all on the same page so that the equipment is being used appropriately. I think we're pretty well there.
Thank you.
Our next questions are from Patrick Butler of Radio Canada.
On long-term care facilities in the province, any further developments at the U.S. Memorial, and how other similar facilities in the province have reacted to the news that came out yesterday?
From the point of view of other facilities, there are protocols in place, and you recall there was quite an emotional discussion at one stage about prohibition of any visitors to long-term care. The case in St. Lawrence, from a timing point of view, it is possible that individual may have been exposed from contact with a visitor, but it's also possible it could have come from staff. There's an overlap there. As time goes by, the visiting element and the incubation period will take care of that particular piece. In terms of testing, my understanding is that all the residents have been tested, and I think there's all but one test outstanding, and so far they've all been negative. Contact tracing is going on now through the staff, and that will follow its normal course. Because it's a hybrid unit with a Category B emergency room, that area, that acute portion of the facility has been closed down for cleaning, and patients who require those kind of services have been diverted to Buren. My understanding from the staff at Buren last night is that there has been no challenge in rising to meet that demand from St. Lawrence.
And you mentioned the announcement tomorrow night. Why is the province choosing to reveal this information at this point, and why move the timing of the briefing to later in the day? I mean, people are used to this time and are tuning in regularly now. Why make that decision?
From the point of view of the projections, some of our statisticians are concerned about modeling because it means different things to them than it does to the general public, but that's a term that seems to have garnered currency. We're just at that point now, in the same way Alberta and Saskatchewan and Quebec and others have arrived at that point today. The key for us was having sufficient patient data points to be able to use it to try to model or predict the future. With the way our data and our disease pattern had unfolded until very recently, whilst you can run these scenarios, the epidemiologists were really very unhappy about the confidence they would have in the answers that they got.
Our next questions are from Peter Jackson of The Telegram.
Hello.
Hi, Peter.
Hi. With regards to the nurses and PPE, and yesterday you said that there's an agreement in place, people were on board. That seems to completely contradict the nurses. They have a current campaign. They want the same sort of say in the use of N95 masks as their counterparts apparently down to in BC, Alberta, Ontario, and New Brunswick. So what exactly is the conflict there? Is there any validity in their request?
They have expressed concerns about availability and appropriateness. What we're trying to do, and as I say, we met with them and discussed with them as recently as yesterday through staff, what it is their concerns are about what equipment should be used in what circumstances. I think part of this is showing them the evidence we have from other jurisdictions on which they have based their decisions. I'm not sure that I would be able to tell you immediately what today's point of immediate contention might be. Those discussions are frequent and ongoing, and there are discussions going on a daily basis. The important thing from our point of view is to make sure our frontline workers are protected appropriately, but equally our other issue is to make sure that our challenged supply chain is used appropriately, because we don't have any margin for inappropriate use or wastage or hoarding.
Okay, and my second question is that the mayor of Goose Bay and their MP, following the Nalcor incident yesterday, they're now wondering why Nalcor is bringing in workers for jobs such as cleaning and security that could be done locally. Is it some kind of a loophole having to do with maintaining separation?
No, it's not about maintaining separation. It's I became aware of this late yesterday, as I mentioned actually in the conference yesterday, about some workers going into as a changeover into Muskrat. Some 80 workers, 50 out of them would have been flown in. So from my point of view, and based on the conversations that I had with our MP and our MHAs in that area, and also with the CEO of Nalcor this morning, as well as with the Trades NL. So we're working on a solution here. You know, our objective is to make sure that only essential workers fly to those sites. And so some of the questions around, as you just mentioned, Peter, around people for cleaning and other services, such as security, has been mentioned. So these are things that we're following up on now. And as I said, I've talked to all those individuals, and we're working on a solution here. So clearly for us, we want to see essential travelers only into Labrador or into any region of this province. So it's essential travel, and this is what we want to see as we go into Labrador and into other regions of the province. So that'll be our focus.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News.
Thank you. Minister Haggie, yesterday you had said that there had been an agreement on PPE, but NAPE and the Registered Nurses Union are saying that there was actually no overarching agreement. Your response to this?
Yeah, I mean, it's very similar to the question I was asked a few seconds ago. The facts of the case are that there are daily discussions between these groups and others in terms of QP and allied health professionals. They've also been involved in some of these discussions. The facts of the case are we're trying to make sure everybody has a common understanding of the challenges and the requirements. Our aim is to make sure that frontline healthcare workers have access to the PPE they need when they need it. And equally with our challenged supply chain, we need to make sure that the PPE we have is used appropriately. There are different evidence-based guidelines for different circumstances. Not everybody needs, for example, an N95 mask. On certain circumstances, a surgical mask and a full face shield, along with whatever other PPE is appropriate, would be appropriate. So we need to make sure that the equipment that we're providing is used appropriately so it goes the furthest and is available for the most staff and the most patients.
Thank you. And is it possible to be given the location of the recovered cases for the region?
Certainly, I have those here. If you look at the recovered cases, we have 49. 44 are in Eastern, 1 in Central, 1 in Western, and 3 in Labrador-Grenfell.
Kellyanne, there's a question that comes up quite often about this. So when we put out today 228 confirmed cases, these would include the recovered cases, so they are not subtracted. So these 228, when you look at active cases, would be minus at 49. So, you know, many people often ask about the numbers that we keep updating every year. They include all the positive cases that have been diagnosed around the province.
Thanks.
Our next questions are from Holly Mackenzie-Sutter of the Canadian Press.
Please press star 1.
Hi, question for Minister Haggie. On your comment that this upcoming weekend is going to be critical for the province, are you basing that on the models that we're going to be seeing tomorrow?
I'm basing that on the fact that traditionally this is the first big family religious holiday weekend that follows Christmas. We are a very social and sociable province, and you only have to be on the roads on Holy Thursday to see the amount of traffic that under normal circumstances would be heading to meet up with family or to go to cabins or to go to various religious activities. That has got to change because we know very clearly the only way this virus moves is if people move. And people are on the move this weekend traditionally. That's why the bulk of my comments earlier were around rethinking our Easter traditions and how we do family. If you want your fish and chips, cook it at home and join in on Facebook or FaceTime or Skype.
Thank you. And just more specifically on PPE supply and masks in particular, do you have a rough estimate of the supply and how long that would last right now, even in a range of hundreds to thousands?
Yeah, we can get numbers. The real key, though, is what we call burn rate, and that is how fast the system uses that on a daily basis, because we get supplies on a delivery date when the system works. At the moment, we have, depending on your particular PPE, anywhere from 1 to 10 weeks of supply.
Our next questions are from Drew Brown of Independent.
Yeah, just wanted to say great job with all the public information that's coming out of basically the website. But one thing that is missing that we see both provided by Ontario and nationally is the details of the dates of illness onset. So currently we only know when cases are announced, but not when symptoms first appear or when samples are first collected or anything like that. Is there any way to provide some of this information?
You were asking about date of symptom onset? Is that what you were asking?
Yes, yeah. Just more information to help with modeling purposes, basically.
So that information is something we use on a regular basis to try to determine when we're looking at the epidemiology of it. I mean, it's certainly something we could provide, I suppose. It's I don't know that it'll add a whole lot of information with regard to our numbers or things like that, but it's something that we use certainly when we're analyzing information.
Perfect, thank you. Yeah, my other question got spiked by Peter Jackson, but yeah, I was just also curious about the the calls for shutting down non-essential travel is growing. The town of Goose Bay is going to have a motorcade or protest tomorrow night. So I don't know if the government is looking at preparing to make any more restrictions on travel into Labrador.
Well, into Labrador, and I explained and talked at great length about Labrador region yesterday, is we have the ferry system right now that have very stringent rules. They've decreased the number of passengers on the ferry going into Labrador from down to 53, and in the last few days they've had about 20 passengers, and the reservation system are showing that will even decline more. From a transportation going into PAL, the only air traffic that can go in there now would be through Provincial airlines and some distribution with Air Borealis around the north coast of Labrador. So it's really down to Provincial airlines. So on a daily basis, we're tracking those numbers that are going in there, and they are for essential travelers only. And that's the policy of the airline as well. And I know there's been occasions when they've actually taken passengers off because they were not deemed essential. So we've also see on the from Fairmont into Labrador West, we have checkpoints set up there, asking travelers going into Lab West, what the reasons would be. Again, that would have to be for essential travelers, and the same, and likewise down into Blanc and into the Straits area of Labrador. And so if you're traveling from Quebec or to Quebec, it would be for the airport only. And if you're traveling into Quebec, it's where the ferry leaves in Blanc. So very stringent rules with checkpoints and questions, through every time you enter Labrador. So it's essential travel only, and we have the various mechanisms in place in Labrador. But the same is true for any area of the province. If you're leaving St. John's and you're going anywhere, it's for essential travel. And this is really to protect people. And as has been said so many times, we really got to live our lives thinking that the person next to you, the next person you meet, is positive for COVID-19. That is how we stop this spread. So essentially, we have the cure, we have the mechanism to stop this spread. We just need to execute it.
The other comment, if I may make on that, is I understand my colleague from Municipal Affairs and Environment actually issued a public service announcement or a public service advisory around the issue of parades and motorcades. And I think it's essentially to get municipalities and fire departments to discourage them and not undertake them.
Fair enough. Thank you very much.
Thank you, Minister. We'll now go to a second round of single questions. Do we have a question from Elizabeth Whitten of All Newfoundland Labrador?
Hello?
Hello.
Hi, Dr. Fitzgerald. I was wondering, have there been any more cases linked to community spread, or is it still just the single one known case?
So community transmission means that...
Oh, that's fine.
Yeah, it simply means that it's being transmitted in our community. So we have had some cases of transmission where the source was unknown, and so we assume that that comes from community transmission. And there have been, I think at the moment, I think we're up to 3 or 4 cases that are unknown source. But the transmission related to the calls cluster, for example, that technically still qualifies as community transmission because it is transmitted onward in our community. However, we can find the source for it. So there is community transmission related in our province, and it is ongoing, and we have to assume that it is not just here in the metro area. We have to assume that it's anywhere in our province, and we have to behave accordingly by trying to stay home as much as possible and making sure that we're socially distancing when we are out, making sure we're washing our hands very carefully, and all of those things to protect ourselves. That's the most important thing, and that's what will work to prevent the spread further.
Thank you.
Do we have a question from Peter Cowan of CBC News?
There are no questions from Mr. Cowan.
Ben Murphy of VOCM.
Oh, yeah, sorry.
Oh,
Mr.
okay.
Cowan, just press star 1. Please go ahead.
Okay.
Question for Minister Haggie about motorcades. You'd indicated that communities shouldn't be doing them. They've been a good morale booster as a way for either showing support for healthcare workers or marking a significant event in the community. What is the health risk, and why are you telling communities not to do them now?
This directive came from Minister Bragg's department. We have had concerns expressed from the point of view of the fact that these motorcades originate somewhere and end somewhere, and that at those beginning and end points, again, you've got the kind of parking phenomenon I've alluded to with other things, teens, adults in coffee shop parking lots, where social distancing, physical distancing is breached and not observed. And again, that is a cause for concern. That is the kind of place where inadvertent transmission of the virus is going to happen. If you have face-to-face contact with people, that's when the virus moves. It moves if you move. You don't move, it doesn't move.
We'll now take a question from Ben Murphy of VOCM News.
Minister Haggie, we've heard from families here that are being told if they take a family member out of a long-term care home, that senior's placement is no longer secured and they'll have to go back on the wait list. Nova Scotia has stopped this. We have any thoughts on changing this?
Our situation here is such that long-term care beds, and by which I'm referring specifically to regional health authority operated ones and specifically to long-term care beds as defined in that way, that's always been our pressure point. At the moment, the acute care sector is really keen to be able to move any alternate level of care patients who would need long-term care beds, out of the acute sector to make room for those individuals that we expect in the coming weeks or so with COVID-19. So what will happen if the safety assessment and the care needs of an individual who's in long-term care can be adequately met in the community, and the individual and or their substitute decision maker wants to do that, that bed will then be repurposed for someone from acute care and will no longer be free. I think the real question is, for long-term care people, the level of care that is required now for our typical long-term care resident is such that it would actually be an exceptional challenge to manage in the community at the moment. We do not have sufficient home support workers. We're hearing at the moment that we're managing because overtime is required from those who are currently employed through agencies or self-managed. So that would be an additional stressor on that system and begs a whole series of questions which are very patient-specific. But certainly for the duration of the pandemic, any long-term care bed that's empty is likely to be filled by patients who would come out of acute care to make room for COVID patients.
Thank you.
Do we have a question from Patrick Butler of Radio Canada?
Hello. This is the smallest increase in the number of cases that we've seen in over 2 weeks now. Is this a sign that the measures that you're implementing are working?
This is a sign that we've had 2 cases in the last 24 hours or since the last media advisory, and that is all. There are going to be days like this that we only have a few cases, and then there are going to be days where we have more. We are at the very beginning of this, and I would caution anybody from trying to read too much into today's numbers.
Do we have a question from Peter Jackson of the Telegraph?
Hello.
Peter?
Hi. I have a question about there are photographers who would normally be doing in-house or in-studio portraits for Christmas with families or babies or whatever. I assume that would be discouraged, but what about at least one we're aware of who's doing portrait-to-portrait photographs? In other words, staying like about 10 feet away and doing pictures of families on portraits.
Haven't been specifically asked about that. I suppose if social distancing could be maintained, that could be a possibility. However, I certainly would caution anybody about going out and trying to rush to book such appointments.
I think we just must keep in mind, this is really about essential services, so and what's priority. And I understand, I'm a grandfather, and we would like to get pictures taken, of course, of all key events and things like Easter, I guess you're referring to, Peter. But there's sacrifices that we must make to protect the very people that we want to take their pictures of as well. And so you never know who the next person you meet, as we've said so many times, working and living on the assumption that the next person you meet could be positive for COVID-19. You could get infected, and the very person, that could then be impacted on something as simple. But the real question comes down to, is it truly essential? The service that you're about to engage in, is it essential to you?
The next question is from Kellyanne Roberts of NTV News.
Thank you. I'm looking for some clarification on a question that Peter Jackson had asked, that in BC, Ontario, New Brunswick, and Alberta, the N95 masks, if RNs feel the need to use them, can, and in hot spots like COVID-19 units, ERs, ICUs, they are wearing them at all times. That's not happening here. Why aren't we following the same guidelines as other provinces when it comes to this type of protection?
I think you might want to look at the nuances of what indications they are being used for in those areas. The facts of the case are we have evidence-based guidelines that clearly state what circumstances a particular type of PPE should be used in and for. We have, Dr. Fizgerald's recommendations and her team have been based wherever evidence exists. We have used that, and we have presented that to the representatives of the workforce, be it the RNU or NAPE or whomever. The facts of the case is that those guidelines have stood the test of time, and it's always a balance between the appropriate use of PPE and making sure that our frontline workers have the protection they need. That's a line that we always have to look at, and it's a line that changes, as you've seen in other areas of discussion this afternoon. The recommendation about non-surgical masks has changed. The recommendations about masks for visitors in hospitals have changed. The recommendations that we have, that we're using at the moment to base our evidence, our decisions on, are based on the latest evidence that we have. If there is peer-reviewed evidence out there that says differently, we'll certainly look at that, and if we need to change, we will.
Thank you.
The next question is from Holly Mackenzie-Sutter of the Canadian Press.
Hi, question for the Premier. We're seeing, advice from yourself and others that we should work from home where possible. Can you comment on why you haven't done that yet, and I guess what the bar would be for yourself to start working from isolation?
Yeah, so I'm, as most of you would know, that I still live in Deer Lake, which I haven't been back there, I think, now in about 5 weeks or so. So I've been living in St. John's here throughout all of this. And so I've been to my office, come to the office every day, come to these media events. I think we're day 24, day 25 or something, and more for Dr. Fizgerald.
28.
28 for Dr. Fizgerald. So you can see, so for us right now, it's about making sure that we're publicly available to as many people as often as we can. And sometimes that can be difficult. Of course, Dr. Haggie and them on the weekends have been able to do that, and Dr. Fizgerald from time to time. So for me right now, there's still a lot of other things that's going on. With government, of course, this health crisis is the number one situation that we're dealing with, but there are still some other things that are going on. So for me, it's, straight from my condo, to the office. That's it. I get outside maybe for 200 feet a day. That's clearly just a walk to the car. And so for me right now, I've been able to do so, practicing a safe physical distancing, proper hygiene, of course, which is all readily available to me where we work, with a very limited number of people that would work within government. So there's a time that you need to be able to, government continues the services that we provide. So as we work together in what is a very safe environment. So for me, I guess if I was feeling symptoms, I would be staying home. And likewise, everyone, that if I meet with in the mornings at all in an environment that is very safe, that likewise no one comes into our office that would be exhibiting any symptoms at all. So right now it's a very closed environment. The bubble is what it is, and there's very few people, that are inside that bubble.
Our final question of the day is from Drew Brown of The Independent. Please go ahead.
Just a super quick question about food security. We've seen Minister Byrne talk about the fact that milk has been dumped because grocers weren't buying and limiting customer quantities. I don't know if does the government have any plan to sort of step in on these sort of strange supply and demand problems with the grocery system here?
So in terms of supply and demand, we meet, quite regularly, or talk with quite regularly with the food distributors within the province. And so far the inventory is intact. We will see, I think, over time, a number of the items, the SKUs as they call it within that industry, they will probably shrink over time as manufacturers continue to focus on what the priorities are to, satisfy as many of the customers as possible. So for an inventory point of view, we're seeing, from what the grocery stores are telling me, and likewise with our with pharmacies and so on, that even though we've seen some restrictions placed here, we do not see any long-term shortages that would have an impact on the distribution of products. So government right now, as we see from food banks, as I mentioned there today, an extra $60,000 on top of the $500,000, which is on top of the $220,000 that we've put in place to make sure we can keep as many food banks going as possible. So we realize that there's a lot of great partners out there as well. We've seen some of the suppliers themselves that have stepped up and made some significant donations. So this is top of mind for all of us, and this is just about food. Some of the other vulnerable people in our society that require things like housing and so on. We're working very closely with those groups as well.
Great, thanks.
Thank you very much for tuning in. The time for questions has ended. Please join us again tomorrow at 6 o'clock p.m., 5:30 in Labrador.